Welcome to the Cancer Institute at the University of Tennessee Medical Center.
Hello, my name is Lindsay, and today I would like to share with you a little bit about what to expect on your chemotherapy treatment days. We understand that the idea of chemotherapy may be scary for some patients and family members, but we hope that your experience with us is one filled with quality education, compassion, and an environment dedicated to healing. We try our best to make this journey as comfortable and enjoyable as possible, so please let us know if there is anything we can do to help accommodate your experience during your time with us. Cancer treatment drugs come in all shapes and sizes. Some patients receive chemotherapy drugs and others receive biotherapy or immunotherapy drugs. Your medical oncologist will determine the best treatment drugs for your cancer diagnosis. To safely administer these drugs, a complete blood count, CBC, and/or a comprehensive metabolic panel, CMP, will be required based upon the treatment drugs you will receive. In order to allow time for your blood work to result prior to treatment, please arrive at least 1 hour prior to your scheduled treatment time. The Cancer Infusion Center opens daily at 7:30 a.m. If you have an 8 a.m. appointment, please plan to arrive at 7:30 a.m.
If you have a port, you have two options. You can choose to go to the Cancer Institute lab and have your blood drawn from your arm, or you can choose to come to the Cancer Institute Infusion Center and have your blood drawn from your port. If you do not have a port, you will be directed to the lab to have your blood drawn. On average, it will take 30 minutes to receive the results from your complete blood count, your CBC, and up to 2 hours for a complete metabolic panel, CMP. If having chemotherapy only, you do not have to stay in the Cancer Institute Center while waiting to receive the results of your blood work. You may request a pager from the registration clerk, which will work within the Cancer Institute building. You may wish to wait in the large main Cancer Institute waiting area on the 4th floor, or the 1st floor waiting area, which also has a small cafe that is open from 8:30 a.m. to 2:30 p.m. If it's convenient for you and it's appropriate for your type of treatment, you may be able to come in up to 3 days prior to your treatment date to have your lab work drawn. If you choose to do this, make sure and let the checkout clerk know so that they can schedule you appropriately.
Sometimes you will be scheduled for a physician visit and treatment on the same day. Other times you will be scheduled for a treatment only. If you are scheduled to see a physician, you will continue to the physician waiting area after your lab work is drawn.
If you are not seeing a physician, you will wait in the Cancer Institute Chemotherapy Waiting Area, also known as the CIC Waiting Area, or request a pager to wait in another area of the building. Please note that some patients will enter the CIC waiting area after you have arrived and be called back for treatment before you. Please remember these patients may not have needed lab work, may have been waiting in a different area, may have an earlier appointment, or may have his or her lab work drawn prior to the day of treatment.
One caregiver may accompany you to the treatment area. If you have more than one caregiver with you, we ask that he or she remain in the large lobby. Caregivers may switch in and out during your treatment time. On your first day of treatment, 2 caregivers may accompany you to the treatment area to participate in chemotherapy education. After education is complete, we ask that 1 caregiver remain.
No children under the age of 14 are allowed in the chemotherapy treatment area. Additionally, we ask that you park only 1 vehicle in the Cancer Institute parking lot. Additional parking is available directly across the street in H Garage, and we do offer valet parking in front of the Cancer Institute.
Your treatment will be administered in one of 6 coves. Each cove has 6 reclining chairs, wireless internet access, and a TV. Each area also has a curtain which may be pulled for privacy. Most patients prefer not to use the curtains. Your privacy is important to us. So if you'd prefer us pull the privacy curtain, then please have that conversation with your nurse, although most patients prefer not. However, if you're getting a drug that has the potential for causing any kind of adverse reaction, we may ask that you keep the curtain open so that we can monitor you more closely. Please wear comfortable clothes and dress in layers on the day of treatment. Please refrain from using fragrant body lotions or perfume on treatment days, as some patients are very sensitive to smell. There are 2 registered nurses in each cove to provide care for you. Both nurses are specially trained in oncology, so if you have any questions regarding your lab work, your treatment, what to expect during the day, or once you go home, please don't hesitate to ask. We encourage you to bring your favorite snacks and drinks with you to treatment. We also encourage your caregiver to do the same. As our patient, we'll provide a light lunch, drink, and snack. Our only request is that you ensure that none of the foods you bring have strong odors, like popcorn, onions, and fish.
The amount of time you spend in the infusion area will largely be determined by which medications you receive. Oftentimes, patients will receive what are called pre-medications before your treatment medications. These medications help to prevent allergic reactions, nausea, or vomiting that may be caused by your treatment medications. However, not all patients need to receive these medications. We encourage you to clear your schedule for the first day of your treatment. You can use this first day to gauge how long your treatment will take and how you'll feel once your treatment is completed. After you have determined this, you can plan for future treatments accordingly.
Our Chemotherapy Infusion Center team strives to make your treatment day as pleasant of an experience as possible. We are concerned for your comfort, so please speak up if there is something we can do to make you more comfortable. Your care and satisfaction is important to us. Please don't hesitate to contact us if you have concerns, unresolved issues, or questions about services and resources.